Hi, my name is Dr. Robin Abramczyk, and I'm a holistic and biological dentist in Heath, Texas. The name of my practice is Smile Ranch Dentistry, and I am here with one of our favorite patients. This is Alistair and his mom, Kaitlyn. And Alistair had a frenectomy recently, and I just wanted to invite Kaitlyn to share a little bit about their journey and what she experienced, because her experience was a little bit outside of what we're used to seeing, and I just wanted her to share a little bit about that with you today. So Kaitlyn, can you tell me a little bit about when he was first diagnosed, or you felt like there was something going on with his nursing? Who identified that?
Well, actually, I did. My first son, who's 2, we're nursing. We're tandem nursing at the moment. He was tied, and we fought through a bunch of struggles and everything like that, and I was able to identify it, but we didn't get it corrected. And I thought, okay, if the second one is tied, we need to get this corrected, because it was months of anguish.
Okay.
So actually, right after he was born, he latched onto nurse, and I immediately felt the same kind of tie symptoms: clicking, compression on nipples, all that stuff. His chin would quiver.
Yeah.
He was tired.
Fatigued.
Yes.
Yeah. Oh gosh.
Yes.
So you were determined at that point, I want to go ahead and have this released.
Yes.
And you were aware that you needed to work with a body worker and with a lactation consultant. You were already educated before you came here to Smile Ranch.
Right, absolutely. We had the plan in place, and then we came in, and he was revised at 8 days old, on his 8th day.
Yeah.
Nice and early, definitely good.
Wonderful.
Yes.
So, after the procedure.
You know, a lot of, stuff that you see online about tongue tie, lip tie, they say revision, it's kind of seen as like this magic bullet. Like, once you get it revised, everything's fine. And I'm sure that happens in some cases, but in our case, it was anguish. It was pretty hard for about 8 days post-procedure.
So did you come in here with the mindset, oh, it's going to be like a magic wand?
Yes. Yes,
I felt that.
Silver bullet. Yeah, it was gonna,
But that's for most people, it's not that way.
Yeah. Oh, yeah. I know now.
And most of my patients, they typically have some symptoms for a couple of days around stretch time.
Yes.
Some, it's like this baby never even had.
Yeah.
That's it's a little more rare.
Yes.
And then some of them struggle for about 5, but he struggled for 8 days.
Yes.
What was that like?
8 days. It was anguish. It was just complete and utter anguish, because I'm nursing a 2-year-old, and he's latching on just fine, and we have, great nursing relationship. And then my newborn, he's not wanting to latch. He wasn't wanting to eat? No, he wasn't wanting to eat.
Him?
Well, I put him to the breast as much as possible. We did a lot of skin to skin. I ended up meeting with a lactation consultant, who was wonderful.
Yeah.
She got me set up with a syringe feeding, and then we also did bottle. And at that point, I was expressing milk, and then I would syringe feed him, and then try to put him to the breast after he was syringe fed. Kind of sated a little bit, and we did that. It was kind of a hodgepodge of things for a little over a week.
Yes, over a week.
Yes.
Wow.
Yes.
And then what about body work?
So we ended up starting with the body work. He went in a couple of days post-procedure, and that helped him. Every time after the body work, he seemed more relaxed, more willing to eat, which was wonderful. And then finally, the day after our 1 week post-op, which was a Friday, we had body work with Dr. Jenna, and finally that night and into the next morning, something just clicked in him, and he was much more relaxed. And so I started doing a little bit of suck training with him, getting him to because his problem was his tongue was elevated just to the roof of his mouth. He was guarding. He didn't want anything in his mouth. And so we did suck training, and then of course the body work. And then the lactation consultant spent many evenings on the phone with me, listening to me try not to cry. But eventually...
And you and I... we talked like almost every single day, multiple times.
Yes.
So you had a great support around you.
The support system is absolutely necessary. You need to have a dentist who's a preferred provider, who knows ties. Don't just go to anybody. You need to have a body worker who knows about tied babies, who knows how to work the cranials, and you need to have an LC who's
Absolutely.
Well versed in it, because this is coming from a mom who's nursed for 2 years.
Yes.
And I know how to nurse babies. I know how to, and I couldn't nurse my baby, and I took 5 people between you 3 and my husband and my sister to keep me on this edge of sanity.
So have people who know what they're doing.
Yes, even if they're online, even if you don't have somebody in your family. Yeah, exactly. Okay. Get with somebody. Yes, absolutely.
That's wonderful.
And know that it can happen.
How are things going now?
It's wonderful. Wonderful. So much better. We've been nursing. We haven't needed to do any kind of syringe feeding, no bottles, none of that kind of stuff. I haven't had to express. He's been back to the press for a few weeks now, and he's doing great.
And you're happy.
Oh, I'm ecstatic.
Oh,
yes.
That's so wonderful. This is what we work toward. This is what we want, and this is why we do what we do.
Yes.
Okay.
Sometimes it's just a little harder. You have
So your advice to a mom who has their instinct is, my baby has a tie.
Yes, educate yourself. Get with a good, recommended provider. Don't just go to anybody who'll clip, because you need the support afterwards, and then you need to have that lactation consultant set up. You need to have the CST. I mean, because this is coming from. I mean, I've nursed kids. I can't imagine a first-time mom or a first-time breastfeeding mom getting through it. I mean.
Overwhelming.
Yes, absolutely.
Wonderful. I appreciate you so much for sharing your story.
Of course.
And thank you for joining us.